Pregnancy is a time of great joy for women and their families around the world. New life is being brought into existence, and with that comes celebration in all cultures of the world. But for many, news of pregnancy is met with great apprehension rather than great excitement. This is because, globally, 800 women die every day from complications related to childbirth and pregnancy. Major causes of death include severe bleeding, infections, eclampsia, and unsafe abortions, as well as numerous cases related to preventable diseases such as malaria and AIDS. But in all cases, maternal mortality is almost completely preventable. While these figures may be shocking, it is even more shocking to know that 99% of these deaths occur in developing countries. To illustrate this disparity, consider the fact that in the United States, there are only 16 maternal deaths out of every 100,000 births, but in developing countries, there are, on average, nearly 15 times that, with 240 deaths per every 100,000 births. Looking at this map, one can glean a full picture of where maternal mortality rates are highest. Some of the most appalling maternal mortality figures come out of Nigeria. Nigerian maternal mortality accounts for 10% of the total number of maternal deaths across the globe, with an estimated 140 deaths per day, and are second only to India in terms of number of deaths per year. According to the National Population Commission, there are 20 deaths related to disabilities and infections in Nigeria for every single maternal death, reflecting serious issues with Nigeria's health systems, as well as the cultural and infrastructural problems facing mothers. Though maternal mortality rates are unacceptably high, there are ways to help. But this requires looking into the causes of high maternal mortality rates across the globe and thinking on what can be done to address them. In doing this, we believe that the causes can be divided into medical, economic, and cultural categories. Medical causes of maternal mortality surround lack of sanitation, nutrition, and disease treatment and prevention. HIV/AIDS, in particular, poses a major threat and is alone a major inflator of maternal mortality rates, especially in developing nations. As well, women frequently become pregnant with little to no access to maternal medical care. Sanitized clinics may be available, but typically only miles away from rural villages, and well-equipped hospitals are usually out of the question. In Nigeria, many of the doctors are male, and women are often reluctant or uncomfortable speaking with men about personal medical issues or questions relating to their pregnancies. Even more frequently, women may have no access to a doctor at all and cannot receive proper care before, after, or during the birth. One option more readily available is midwives. Midwives help women communicate with their doctors and can also create a clean, safe, and peaceful environment for women to deliver their children, helping the life of both the mother and the child. But midwives are in high demand, and there are not often enough to meet women's needs, leaving many women alone to deliver their babies. On the topic of midwives, Nigerian women have this to say.
When you have one midwife to about 20 women, WHO says 1 to 4 patients, and it becomes difficult when you have to manage large number of patients.
And you can't imagine a midwife who is both hands dipped in the blood, and we're talking about HIV, infections, sexually transmitted diseases, and you don't have water to wash with.
Poverty often leaves women in the developing world malnourished and living in unclean, unsafe environments, even if they are pregnant. Because clinics are too few in number and poor transportation infrastructure makes accessing them difficult, many women are prevented from accessing proper prenatal and antenatal care. Though in Nigeria, the government has tried to increase the number of medical facilities, the country's economic hardships have made this a challenge. Women face many cultural setbacks that make them more at risk during pregnancy. One example is contraceptives, which are often taboo in the countries where maternal mortality rates are highest. According to the UN, only 14.6% of Nigerian couples use contraceptives, and this is because even though knowledge of modern contraceptives is widespread, use of condoms or birth control pills is not considered important, even for those not seeking to have children. This not only makes women more susceptible to diseases that can complicate their pregnancies or even lead to death, it also results in women becoming pregnant more frequently with smaller spans of time in between pregnancies. This is a problem because the chance that a woman will die during pregnancy greatly increases when she becomes pregnant shortly after giving birth. This is why even addressing the economic and medical needs of countries with high maternal mortality rates is not enough to solve the problem for good. Fortunately, many of these causes are preventable, and solutions exist for combating maternal mortality in Nigeria. Experts believe the only way to bring down maternal mortality is to have self-determined pregnancies with child spacing, care during these pregnancies, and access to hospitals for complications. To do this, the Nigerian government has trained and sent traditional birth attendants, also called midwives, to help women deliver babies.
In northwest and northeastern Nigeria, there are very few qualified health human resources, and yet girls don't take up this profession as they should. So I want to use this opportunity to call on parents and all of us to ensure that our daughters, our sisters, our wives, our neighbors take up this profession. It's very important to safeguard the lives of our mothers now, but also into the future.
While the Nigerian government has brought down the number of women dying by nearly half since the 1990s, much work remains to be done. Traditional birth attendants are effective, but to really solve the problem, it must become much less difficult to seek out and receive healthcare services in Nigeria. And although Nigeria's poverty problem makes a drastic overhaul of the healthcare system difficult, efforts to work with local governments to promote maternal health among women shows promise. Promoting family planning and making medical services more readily available is believed to be the most beneficial action at this moment. The UN Population Fund's women's health specialist, Olambunmi Asa, says, quote, "We have a high percentage, 23% of adolescents coming up with unwanted pregnancies. They go through complicated abortions and add to the mortality rate that is already high. According to Asa, maternal mortality could be reduced by 30% in Nigeria if women's health services were promoted. The UN Population Fund, Natal Care Partnership, and other groups have been working alongside the Nigerian government to teach women about maternal health, because a large part of the issue is educational." If you are interested in helping put an end to high maternal mortality rates, you can work with these groups by spreading awareness of their causes and donating to them. Lack of money is a severe restriction on countries like Nigeria's ability to deal with this issue, and donating to these organizations will help them in reaching their goal of building a world where women don't have to fear something as beautiful as having a child.